But today, it's now been 3 years since the first case of COVID-19 was confirmed here in Canada, and it was right here in Toronto. And the city's medical officer of health, Dr. Eileen De Villa, of course, played a central role in helping the city navigate that time. Pretty remarkable to think back that it's been 3 years, Dr. De Villa. We talked to you so much over the last several years, and of course, live once again this morning on CP24 Breakfast. Appreciate the time this morning. You know, what I wonder to you is significant both from a public health perspective and also, excuse me, from a personal perspective on this anniversary.
So, well, Nick, thanks again for having me here. Yes, we have met many times on screen over the course of the last 3 years. And, as we mark this occasion, 3 years since that first case was identified here in Toronto and in Canada, I think there's much to reflect on. I think there are many accomplishments and, the fact that we've come through so well, I think is warranting celebration. But by the same token, I think we still also have to reflect on those that we've lost and those who are still suffering with COVID-19. So it's a little bit of a, two kinds of acknowledgement, a recognition of how far we've come, and at the same time, respecting and appreciating that there are those that we've lost over the course of the last 3 years and those that are still suffering right now.
Yeah, that is definitely so important to put that into perspective as well. No doubt about that, Dr. De Villa. In the meantime, we don't sort of see the daily testing numbers now. We don't hear about the hospitalizations, et cetera. So for some people, it may be hard to get a kind of clear picture of where the city is when it comes to the pandemic and when it comes to COVID-19 right now. So where is Toronto? Where are we in terms of dealing with this, managing with this, coping with it?
Well, certainly we're at a better point than we've been over the course of the last 3 years. COVID-19 activity in our city is slowly decreasing, and thankfully our most current dashboard shows that our severity indicators are relatively low. These are good signs, but again, Nick, I just can't emphasize enough, there are still people getting sick. There are people being hospitalized. We do need to think of them and support them as best as possible. And the best way we can do that is to use the layers of protection, to use all the lessons we've learned over the course of the last 3 years. Take up vaccine when it's your time to get it, and to use all those layers of protection, masking, ventilating and being in open air spaces as much as possible, staying home when you're sick. These are messages that are very familiar and still very salient at this point in time.
Yeah, no doubt about that. And of course, 3 years in, you highlighted in your first answer, Dr. De Villa, some of the accomplishments of the city. Toronto had this remarkable vaccination rate, rolling out the campaign, across the city, Vax-TO. We saw all that. The rates were looking really good. I wonder, what kind of lessons you've learned from a public health perspective, though, in this, because, you heard the criticism as much as we all did here about how the pandemic and the sort of the goalposts appear to be changing in some cases, whether masking was effective or not, the recommendations were to protect others, not yourself, then were to protect yourself, 2 weeks to flatten the curve, the effectiveness of the vaccine, all that kind of thing. There were so many elements and moving parts, I guess, to all this. What do you look back on 3 years later and think, what have we learned now, and what are we prepared for now for the inevitable next time?
So, Nick, I would start off with this. When dealing with a brand new virus, a new emerging infectious disease, I think we all have to adopt a certain level of humility, recognizing that we're not going to know everything up front. I do hope that the people of Toronto recognize that as much as possible, I and my colleagues here at Toronto Public Health provided the information as best as we knew it at the time, recognizing that there were going to be times when it was going to change. And so we did our very best to tell you what we knew as we knew it, and then changed it in accordance with new knowledge as it came in. But I think overall, when I look back at our experience here at the city, I am still amazed at how well we came together, how it took all these community partners, healthcare partners, social service partners to bring together the most successful and the most significant vaccination campaign in our history. And we can see by the numbers how successful we've been and how much we've protected and promoted the health of Torontonians. Lots more lessons learned, lots more yet to be put into play for future public health issues. But I know that we have that strength, that resilience, and some pretty incredible partnerships that have been developed over the last 3 years.
Dr. De Villa, that is good to hear. Good to talk to you again on this remarkable anniversary. It seems 3 years out. Thanks for the time today and, of course, all the time. Appreciate this.
Thank you, Nick.